Welcome everyone to those who are already here. We're expecting a couple more people, but we will just get started already. I am very happy to welcome you to today's webinar about living a healthy lifestyle after cancer, and we have a very packed program, so I want to get started right away with some general remarks before we're gonna jump into the presentations. So just some housekeeping remarks. This webinar is recorded and will be uploaded to YouTube afterwards on the Youth Cancer Network YouTube channel, just like the previous webinars. During the presentations, obviously, please keep yourself muted. If you want to ask questions, you can either write them in the chat and we will read them out loud later, or otherwise, you can also turn on your video, raise your hand, and speak and ask the question yourself. But just be mindful that, of course, this is recorded and will be uploaded to YouTube. So just be mindful that that's the case. If you have any general questions or quick questions, Jike and Jaap will be with you in the chat, and they will answer your questions, just so you know that they are part of the webinar team. We would also like to shortly introduce ourselves. I will be moderating this webinar together with Eva. My name is Tessa Fuchs, and I'm a project manager at PenCare. I am working within the YARN project, where this webinar is part of. And among other things, I'm organizing this webinar series, which this webinar is part of. And I'm very happy to be joined by Eva. Maybe you could also shortly introduce yourself.
First, good afternoon to everybody. My name is Eva Wild. I'm a board member of Survivor Germany, which is an association in Germany to represent survivors in different topics. And I'm also a pediatric oncologist, so I have both perspectives, and I hope to get them into this webinar also.
Thank you. Very happy to have you with me. Also, just a couple of words about the YARN project, just so you understand why this webinar is taking place. The YARN is an EU-funded initiative, and its main goal is to empower young people affected by cancer. And among other things, the focus is to build a network of young people living with and beyond cancer, and also to provide resources about psychosocial health, mental health, but also education, career support, long-term follow-up care, and transition. And one of these resources that we are developing is this webinar series. It's called the #QualityOfLife webinar series. And the main aim is to educate and to raise awareness about all the topics related to quality of life for young people living with and beyond cancer. And among others, these topics are late effects, mental health, psychosocial care, transition, and long-term follow-up care, like I just said. And today we will focus about living a healthy lifestyle after cancer. As a last introductory slide, I have just one thing about PenCare, as I am a project manager for PenCare. I just shortly want to bring to your attention who we are. We are a multidisciplinary pan-European network of healthcare professionals, people with lived experience, and their families. So we try to bring in all the perspectives, and our mission is to ensure equal access to optimal survivorship care to improve the quality of life of those living with and beyond cancer in Europe. That was all the introductions, and I'm very happy to show you what we are going to, the speakers we're going to have today. And we're going to start with our first speaker. His name is Ian Murphy, and he's a young person living beyond cancer. He's also a project coordinator, a patient advocate at Childhood Cancer International Europe, and I'm very excited that he will be sharing his personal, but of course also his professional experience with the topic. And yeah, I would say the floor is yours, Ian.
Thank you. I will begin sharing. You should see my screen now. Yes? Perfect.
Yes.
So thank you very much for the wonderful introduction. Hi, everyone. For those of you who don't know me yet, as Tessa said, my name's Ian Murphy. I'm from the US originally, but I live in Vienna, Austria, and I work with CCI Europe as a project coordinator. So I'm also working on the YARN project, and I'm a patient advocate and a survivor of Hodgkin's lymphoma. And I'm super excited and very honored to be here today to talk for a few minutes about healthy lifestyles. So I went for a really nice walk this weekend, and here's a photo I took on my walk. And I guess the question I want to put into the group to get the thinking started is this an example of living a healthy lifestyle? Because it's certainly something that can have a genuine positive benefit for my physical and emotional well-being. But I think the concept of living a healthy lifestyle is not just about going for a walk. Healthy lifestyle as a broader concept has more to do with the difference between going for a walk and being someone who goes for walks, right? It's a longer term concept. And obviously, a healthy lifestyle involves so much more than just going for walks. There are so many factors that make up a healthy lifestyle. In other words, health is more than eating salads and working out. Tessa said that to me a few weeks ago, and it really stuck with me because I think it's a super important point. Living a healthy lifestyle is actually very complicated. Honestly, eating salads and working out is probably a great start, but here is a list of some things I came up with in just a few minutes, just off the top of my head the other day, which also play into living a healthy lifestyle. And as a group, I think if we wanted to, we could sit down and come up with hundreds of bullets like this. So what we're talking about is behavior change, and sustainable behavior change and adopting a healthy lifestyle is extremely complex. This slide here presents just one model for behavior change, and I'm not necessarily arguing that it is a perfect model, but I do think it does a good job of highlighting how complex behavior change can really be. And that goes for everyone, not just cancer survivors. And in addition to that, people don't exist in little isolated bubbles of individuality. People exist within dynamic systems, meaning there are individuals, there are interpersonal relationships, there are community and organization dynamics, and there are societies and policies. So I can put our little behavior change model from the last slide here in this little individual level circle, and that can represent our individual knowledge and beliefs and behaviors. But to support the health of those affected by cancer, we need support in social networks and families. We need support in work and school. We need support from governments and from the broader culture. And to make the greatest impact, all of these levels need to be connected. So yes, individuals should always be thinking, what can I do to be healthier? But for those working in organizations or as healthcare providers or as people that influence policy, we should be thinking, what is the most effective way to impact each level of human systems to support those affected by cancer and to promote healthy lifestyles? Providing high quality information is so important, but we all kind of know roughly what it means to live a healthy lifestyle. We know that we should eat salads and work out and do all that other stuff, but information alone does not guarantee behavior change. So in addition to good information, what people living with and after cancer really need are tools and resources which build on the most relevant and up-to-date research and information. And whenever there exists high quality research and information, we should be thinking about how to convert this information into concrete, actionable tools and resources. And then we should think about how to best distribute it to the right audiences. There's not one single easy approach to doing this, but I think this webinar is one great example of working together to try to address this challenge. And there are some true experts right here in this webinar, and it's great that we get to learn from them today. So speaking of tools and resources, here is a QR code that you can scan to dive deeper into the resources developed as part of the EU KAISnet project, which was a Yarn predecessor project and which we are working to promote and build on in Yarn. And we are developing even more tools in Yarn, and we really want to make sure that they are effective. So please feel free to reach out and give your thoughts on what you think are the best ways to develop tools for people impacted by cancer and the best ways to spread those resources. And in doing so, we can always be improving and make a true positive impact on those living with and beyond cancer. So thank you very much for your time and attention, and enjoy the rest of the webinar.
Thank you very much, Ian, for this, I think, wonderful presentation of showing how complex and how yeah, I'm lacking words a bit, but I feel like you really portrayed very well that it's a topic full of a lot of dimensions, and I hope a lot of the things you raised in the end will get answered by our speakers today. But also, I want to give the audience a chance, if you have any questions for Ian or any comments, that now would be the time for that. So maybe we can wait 1 or 2 moments to see if anyone wants to ask a question. Yes, Maeve, go ahead.
Hi, Ian. Thank you so much. That was really, really interesting to get your perspective as a survivor. Can I just ask, was this something you were really aware of, you know, from your diagnosis, that you had to engage in a healthy lifestyle? Was it something that you were informed by the healthcare professionals about, and was it something that you were aware of immediately, or is it something that further along, maybe 2-5 years post-treatment, that you started to think a little bit more carefully about, or, you know, consider it a little bit more?
Yeah, no, thanks, Maeve, for the question. I had an experience that is probably relatively similar to a lot of the other people with lived experience on this call, which is that at the beginning, so sort of with the diagnosis, I feel like all the information I got was mostly kind of medical and sort of treatment focused. And then when the treatment sort of came to its conclusion, there was some sort of information shared with me about how to sort of move on with my life and be healthy. But then it didn't really feel very substantial, honestly, for me. And it felt like I kind of then had to learn a lot of things on my own, just out of self-motivation to figure out how to be healthy. So yeah, that was kind of my experience, and I'm guessing it's probably similar to some of the others on this call, but I can't speak for the others. Thank you. And I guess I would also just say one thing is it's then also really hard to figure out what is good information, because then when you start going and figuring out, okay, what do I do to be healthy? You hear contradicting things and you don't know exactly what to do, and it can feel really overwhelming. And that's why I think some of the big picture sort of institutional supports and policy supports are such an important element in that.
So thank you, Ian, again, also from my side, and also for sharing the resources you already mentioned in your presentation and you mentioned now. So I see there are no further questions in the chat, and there are no further questions. Yeah, okay. So we will just move on to our next speaker. It's David Jiménez. He is full professor, and he is Chief Executive Officer of Move for Health and leader of the Move It research group at the University of Cádiz. And they are doing research about healthy lifestyle there and about cancer. And I hope that he will share some of his research with us now. So, David, it's your time to start.
Thank you very much. Give me a second to open the... Okay, I think you can see now.
Yes.
Okay, first of all, I'm really happy to be here and to have the chance to share our knowledge between all of us in this nice webinar within the context of our European project. So let's move to the content of exercise, as you mentioned, and healthy lifestyle. Sorry. Okay. Now, so just a bit of cancer, one slide for cancer epidemiology and quality of life that all of us from the different
Sorry.
contexts here.
David,
Yeah.
one moment. We can see your slides, but not in presentation mode. We see
Okay.
them
Let
in
me check it.
PowerPoint.
Maybe it's because of the way to share. I will say in full screen again, and then it will be easier. Okay. I will start in a second. Now?
Yes,
Yes.
perfect. Thank you.
Okay, it was for the window. Okay. Sorry about that. Well, I think I was here from the beginning. Oh, it's going, sorry. Now, as I say, just a bit of cancer epidemiology and quality of life between all of our profile here in this webinar. We all know and we all are aware about the higher number of new cases per year that we have in all the types of cancer. Just to start from the beginning with the reality of the high number of new cases that we have, and then from here move to the many things we can do to help in the quality of life of all these person living with and behind cancer. As we probably are aware also, cancer has many consequences and sequels at the different levels, both physical and mental, and you probably know about the impact in anxiety, depression, stress, even cardiotoxicity, pain, of course, and muscle atrophy between others. So if we know that all of these consequences affect the quality of life of patients or people living with or beyond cancer, we need to be also aware about the very good relevance that has the level of intensity of physical activity and exercise. However, still we have a kind of bad news if we look at the number of physical activity, or better say physical inactivity. We see that almost 30% of adults worldwide are physically inactive in reality, even despite the good effect they have in the health. Or in Europe, for example, more than 80% don't meet the strength training recommendation from the World Health Organization. Or, for example, in Spain, among 60-70% do not practice moderate and vigorous physical activity in the proper way. Even if we move to the global impact in the numbers from the economical point of view, to move the politician, as my colleagues mentioned before, we need to also talk about number. And in this very good paper, it was published how it is expected that the physical inactivity generate new cases of cancer and all other diseases, and how was the impact, economical impact of these new cases of cancer based on the physical inactivity level of the population. And we have more than around 3.5 new cases of cancer only because of the physical inactivity. That means that prevention still need to be one of the holistic approach that we want to promote. And also, of course, this high number of new cases will have a very high impact in the healthcare system of all the countries. So, like an example, I calculate that around between 10 years, more or less, it will have an impact of around 700 million of euros. So to invest in becoming more active and promoting a healthy lifestyle will be very relevant from all the point of view. Well, let's move to the really very important things, which is the relevance of exercise intervention in cancer. It is well known since this kind of paper 6-7 years ago that exercise has a strong evidence about the positive effect in the reduction the risk of cancer, or increasing the survival, or the reduction in the symptoms of anxiety, depression, and increasing the quality of life and physical function. So we have enough evidence from the overall cancer perspective. However, there is less evidence in young and adolescent cancer survival or people living within and beyond cancer. We also published some years ago a small review highlighting the relevance of exercise not only in adult, if not also in childhood. We can see how the impact is all positive. In the different phase of the disease, and the prevention, rehabilitation for the treatment, during the treatment, and after the treatment. And then just show a couple of papers from the literature that highlight the importance of exercise. In this study, they wanted to see how effective was the exercise intervention on aerobic fitness, muscle strength, functionality, fatigue, and quality of life. And in overall, you can see that all of them were improved, but particularly more, those studies were improving in more percentage the muscle strength. Why? Because one of the main consequences in cancer process is the muscle loss or muscle atrophy, as we saw before, and because of that, it is much more. These people get more benefits in this quality than in other like aerobic capacity. As a summary, just to say, it is a number very from the exercise field, the number of met, but in an overall perspective, this means that those participants with lower amount of physical activity has a decrease in the survival rate of around 70%. However, those reaching a moderate to high level of physical activity per week will have a survival rate quite similar to the general population. That means that with a healthy lifestyle, including exercise and physical activity, well programmed, will have a very good impact on the health. In fact, to have higher muscle strength and higher cardiorespiratory fitness reduce the risk of all-cause mortality, and particularly the mortality for cancer. Just one more paper from 1 year ago, it was published, the biggest paper on the effects of exercise on cancer, and this saw an increase in the number of years free of disease in the exercise group in a very significant way. And it was published in the most relevant journal of medicine, New England of Medicine. So exercise and cancer are on the point of view. And which is more particular, don't be afraid about this picture, because we have a lot of information here, but the message is very clear. There is something called myokines that is activated and released to the body when we are doing exercise by the muscle mass. And this go to all the part of our body to make signals and say, we need to make adaptation in the healthy way. This concept evolved some years after to exerkines, that means the same, but not only produced by the muscle mass, if not by the adipose tissue, cardiovascular system, and all the organs in our body during exercise. What I want to say is, when we are doing exercise in a proper way, our body is sending signals to all the rest of the organs just to say, okay, let's improve independently of the situation in which you are. So that's the most important message from the role of exercise. Independently of the level we have, we will get benefits if we do something. And there is this evidence has been shown also in cancer patients in different ways. It has been shown that these myokines or exerkines are increased in cancer patients through different pathways. One directly affecting the tumor cells, another one through metabolic environment, improving the metabolic environment, and the other one enhancing the anti-tumoral immunity, which is a very relevant aspect to increase in those patients. So just to finalize with a not less important part from our previous project, OACUS, and the current one, OncoMove, let's talk about OACUS, which was an European project finalized some years ago, in which we were working with young adolescent cancer patient. And we wanted to make a holistic approach in which we developed like a 4 pillars theory. That means that using those pillars, we wanted to connect people living with and beyond cancer. And those pillars were the pillar of physical activity and outdoor activities, both of them together, the pillar of balanced nutrition and adherence to healthy diet, sustainability and nature as a part of the full process, and of course, physical and mental well-being. Within this project, we develop a lot of resources that we don't have time now to show, but some of them are now improved and included in our current JARM project, which is a very good output, like exercise videos and so on. But we also publish many systematic reviews trying to highlight relevance of physical activity again and resistance training. I will not go one by one, but just to say that some of the key messages of those papers were very relevant and simple. Physical activity not only improve body, if not also improve mental health, self-esteem, and sense. Resistance training is a key component of exercise and improve the quality of sleep time and all the disorder associated, which is this one. I go in advance. Also, we finalize the conclusion of one of the review telling, okay, there is enough evidence about the role of physical activity, but we need to research more about the joint role of nutrition and physical activity interventions and how it's improved the quality of life of these participants. Not only is necessary to promote exercise, if not to know the barriers, motivation, and social environment that those patients need to really perform the physical activity and exercise intervention in a proper way and with a good adherence. And finally, in another review, we saw that it is not only important to do exercise, that I am really happy with this message, if not where you are doing that. So to perform in the outdoor and even a small walk in the outdoor provide healthy benefits. And to show that, an impress paper now is this one in which we publish. We are in the process of publishing from the University of Cádiz with the full consortium. We look first at the barriers that people reported for doing or not physical activity, depending of the phase of the process, before, during, or after the cancer diagnosis. And you can see how sometimes is the time, but all the time is the energy. Of course, during the treatment, the energy is one of the main barriers, and you probably recognize this answer here. But the key message is the red box. Please have a look that higher sleep quality, higher self-reported health, higher self-reported fitness were decreasing the level of anxiety, were related with a decreased level of anxiety in young and adults cancer patients. And exactly or kind of the same with depression. The higher the quality of life, the lower depression symptom, the higher frequency to go out to the nature for doing physical activity, the better profile, the same with fitness, and the same with self-rated health. So if we go through a healthier lifestyle patterns, we will go to a healthier mental well-being, for example, is the message of this project. And the last one is an intervention from the exercise recommendation to the exercise intervention in the real life. We already finished an exercise intervention in Poland with Marcena, which is a young cancer patient also, but at the same time is doing her own PhD, our supervision in exercise in cancer patient. This has been published already now, the exercise protocol, the protocol study. And we have some preliminary result that I'm going to show you quickly, but just before to move, to say that the very good results are coming, because it's an intervention project in which during a follow-up of 8 weeks of exercise, assessing before, after, and after another 8 weeks of exercise training, mixing all the types of cancer patients that we got from different types, just to see something real that we can implement in any context, not by type of cancer, if not by group of population. And we have some preliminary data in which we've mainly make the project that they already mentioned. And we look at the cross-sectional association between body composition, muscle mass, adiposity, or the issue with physical function. As I showed you, that was one of the main consequences. And what we found was that the concept of powerpenia, which means very, very low performance in the lower strength, okay, was very high in all the people living within and beyond cancer, and particularly by type of cancer. Sometimes it was like 100% of them with very low level of powerpenia, even more than the very low level of cardiorespiratory fitness. So the main conclusion is that as we know what is going to happen during and after the treatment, we need to start with the exercise from the really beginning. From the day of the diagnosis, the oncologist need to send patient for pre-habilitation protocol of exercise. Then try to manage during the treatment with exercise as much as possible in coordination with the oncologist. And then after the treatment, it is of course very, very important to reach again the quality of life that they need to reach. That's all. Thank you very much for your attention. And sorry for the beginning with the technical stuff.
No problem. Thank you very much, David, for this impressive results from your research and for sharing them with us. So, are there any questions?
Well, while other people may still be typing or thinking about their question, well, first of all, David, it's so impressive to see all of these results, and especially hearing the connection between exercise and mental health makes me so motivated immediately to go out and go for a walk and do something for my overall well-being. On one of the slides, you shared something about the barriers and preferences, and I think how the barriers can be overcome. So what do you think are how can, especially thinking about long-term survivors, what are typical barriers and how do you think can they be overcome? Is a whole intervention always the best solution, or how can also healthcare providers be supportive? What is your experience there?
Yeah, there is like two different approaches. Those people doing exercise and having behavior before the diagnosis, and those that did exercise before, usually, because the approach is going to be different. For both, they will face barriers, lack of energy, of course, and blah, blah, blah. However, the adherence to the exercise is much more easier to get when they practice before. So the first message is we need to think also in the prevention part, in the educational part, before of the disease, but during the disease. It's not because of losing weight or gaining muscle mass. It is also because of many, many, many health benefits, and your life will change within this approach. So the main aim to me, the main aim to me will be to get an appropriate adherence. And because of that, sometimes we need to do the type of exercise that is not the more effective, but is the more attractive. And then when they start to get some motivation and adherence to the exercise program, then you need to convince them to move to complement to a more appropriate exercise. So start with something.
And to add, do you have any recommendations for doctors and physicians and how we can motivate our patients?
Yeah, the very, very first recommendation will be in touch with some expert from the exercise part, just to be collaborating from the beginning. We are doing now that at the hospital here in Cádiz. It is a hard work, I need to say, but when you found one doctor totally aware and convinced about the relevance, to us, it is like the main door open, because when they say, you, as a part of your treatment, you need to go to do exercise with these people, they will say, yes, that's part of my treatment. It's not the same if we are not aligned in the same message.
Yeah, that's so true. Thank you.
Welcome.
I see we have a question in the chat from Jaap. Are endurance sports good if you have risk for cardiac failure? Very specific question. Can you answer it, David?
Yeah, of course. It's a very specific question and it's very important to solve. Yes, it is good. It is benefit. In fact, with outside of cancer disease, there is the cardiac rehabilitation, which is based on the American Heart Association recommend endurance exercise and resistance exercise, not only endurance, aerobic exercise, if not also muscle strength training. So for cancer, for cardiac rehabilitation, it is recommended. And now, in the context of cancer, it has been starting to study the role of exercise for cardiotoxicity of the treatment. And then, again, the message is we can do endurance exercise and muscle strength or resistance training. However, the key issue is to control the dose, the response of those participants during the exercise. And because of that, people need to be more or less expert.
Thank you. Are there any other questions? If not, you can still put questions for David in the chat, and I'm sure he will be in the call and can answer them. Then we will move to our next speaker. Our next speaker is Saskia Pluijm. She's a senior scientist and associate group leader from the Prinses Máxima Centrum in Utrecht in the Netherlands. And she has, a lot of experience in researching lifestyle behaviors and healthy aging after childhood cancer. And I'm very curious to hear her insights. And Saskia, the floor is yours.
Thank you so much, Tessa, and all of you for the organization committee for inviting me and for organizing this seminar, this webinar. I'm very grateful for that, and also very happy that the topic of lifestyle behaviors and how to change lifestyle behaviors for people beyond cancer is so relevant now and in the picture. I will present about the PenCare follow-up lifestyle intervention that was developed with PenCare from 2019 till 2024, and the PenCare follow-up lifestyle intervention was part of the PenCare intervention, and that was about care, and the lifestyle intervention was integrated in this care, and it was developed together with the whole PenCare consortium, PenCare follow-up consortium, but in particular also with the RUMC, the University of Nijmegen, the Radboud University of Nijmegen, and the Prinses Máxima Center. As you have heard, there are several healthy lifestyle behaviors. These are maybe the most well-known: sufficient level of physical activity, healthy diet, and healthy body weight, not smoking, no drugs, and few alcohol consumptions, sufficient sleep and relaxation, like walking in the nature, and protected sun exposure. In a Dutch cohort study in 2013, the study included more than 3,000 adults who have had childhood cancer. And in this study, the prevalence of unhealthy lifestyle behaviors were that 15% of the people smoked daily, almost 30% drank alcohol daily, 13% used drugs, and 27% didn't adhere to the WHO physical activity norm, and more than a third had overweight or obesity. Healthy lifestyle behaviors may prevent or mitigate the severity of late effects of childhood cancer, and therefore it's so important that we support people who have had childhood cancer adopting a healthy lifestyle behavior. But it's not so easy to change one's lifestyle behavior, as you all might know. It can be very challenging, and in particular for people who live beyond cancer, they might experience specific barriers related to the cancer treatment, like fatigue, might have an amputation, or they might experience anxiety or other psychosocial problems. Qualitative studies, during qualitative studies, they indicated that they need personalized lifestyle support to adopt healthy lifestyle behaviors. And therefore, the PenCare follow-up lifestyle intervention was developed and evaluated. Before developing the lifestyle intervention, we had some guiding principles, namely that lifestyle support should be integrated within survivorship care. We thought it should be personalized support by a lifestyle coach with shared goal setting, so the idea of shared decision making, a shared goal setting between the lifestyle coach and the person who have had childhood cancer. Should be a holistic approach, focusing on several lifestyle aspects and also both mental and physical support. And it should be online so that people don't have travel distances and costs. First of all, for the development of the PenCare follow-up lifestyle interventions, we performed a systematic review and several qualitative interviews to determine or to identify barriers and facilitators of adopting healthy lifestyle behaviors. And the qualitative interviews and the focus groups were both with people living beyond cancer and with their healthcare professionals. And it were also both perspectives. In this slide, you can see in this table, you can see the perspectives of the people who have had childhood cancer. And the systematic review revealed that most of the studies examining barriers and facilitators examined engagement in physical activity. And there were several barriers identified for engagement in physical activity, namely fatigue, lack of motivation, time constraints, smoking, lack of knowledge and lack of skills, fear of injury, lack of finances, having over or underweight, and experiencing physical limitations. Facilitators were perceived health benefits and self-motivation. There were far less studies with the outcome healthy dietary intake or body weight. And also, the barriers and facilitators that were identified were less strongly supported by evidence, but explorative were for the barriers being overweight or underweight, negative influence of social environment, not liking the taste of healthy food, and resources to buy healthy food were not easily available. Facilitators were peer support, available professional support, digital information about healthy dietary intake. The focus group with the healthcare professionals revealed that they perceived information about knowledge about how to educate and inform people about healthy lifestyle behaviors, and also skills how to do that, and the environmental context and resources within survivorship care, so that they have enough time, for example, to give this information and skills to the people living beyond cancer. That were the most important facilitators that they experienced. From this knowledge on the barriers and facilitators, we further developed the PENCAR follow-up lifestyle intervention. We developed it for people who have had childhood cancer, aged 16 years and older, and who had overweight and or exercised too little, and very important, who were motivated to make a change, and also appreciated support, improving their lifestyle behaviors. And the focus was on improving physical activity and or dietary intake, or maintaining or improving body weight. What is the PENCAR follow-up lifestyle intervention? It includes a consult with a healthcare profession at the late effect clinic. And if people were motivated, they get in contact with a certified lifestyle coach, and they got person-centered 3 to 6 sessions, screen-to-screen sessions with a certified lifestyle coach. Apologize for the 3 to 6 screen-to-screen sessions were given during 4 months, and on request of the person who would like to have the sessions, to have the contact with the lifestyle coach. The coach was well trained in the identification of personal barriers and facilitators, and explored those barriers and facilitators with the people who have had childhood cancer. And then they set a personal lifestyle goal for the next coming 4 months to work on. The study was a single pre-post intervention study in which during 4 months lifestyle coaching was given, and then we had a 4 months follow-up after T1 till T2. And 58 participants from 2 centers were included. The effect outcomes were the personal lifestyle coach goal, whether it was reached or sustained. And then we had, with questionnaires, we measured BMI, physical activity, and dietary intake, and we assessed the change from T0 to C2. And people also wear accelerometers to assess physical activity and their physical activity levels. 58 persons started with the interventions, and 53 finished the whole intervention and all the questionnaires at the end. And the results. At T1, directly after completing the lifestyle coaching sessions, 68% of the people reached their lifestyle goal. And 8 months, after 8 months, so 4 months later, even more people, namely 76% of the people reached their lifestyle goal. When we looked at the change in lifestyle behaviors, we also showed that the Penker follow-up lifestyle intervention was effective. People lost weight, half a point of BMI. People improved their physical activity level. With a mean score of 7.7 hours per week. And also the dietary intake was improved, and mainly fat intake was reduced, and vegetable and fruit intake was improved. To summarize, the intervention was shown effective in 68% of the participants, and 76% reached and sustained their goal during the follow-up. BMI, physical activity, and dietary intake improved, and people with a higher BMI and more feelings of depression were less likely to realize their goal. Now, with this knowledge, we have to think about how to implement lifestyle support into care, into survivorship care. And for that, we are working with a big consortium from people all over the world on an IGHD guideline health promotion. And one of the recommendations is that that at the survivorship care clinics, we implement the lifestyle wheel that was developed in the Netherlands for integrating lifestyle support into all aspects of hospital care. And you can see a picture here, and it's a very handy tool. And the idea is that the medical doctor, the late effect clinician, gives the tool to the person who have had childhood cancer, and he or she can look on this wheel and say, I would like to improve one of the 6 aspects of the wheel. And then the medical doctor can ask, okay, you would like to improve, for example, exercise. Do you need help? Do you need help or support with that? And if the person say yes, okay, then the medical doctor can say, would you like support from us, from the late effect polyclinic, or from primary care, for example. So that's the idea, and the recommendations will come in the guideline that we will finish end of August. Thank you much for your attention.
Thank you very much, I think ideally we would have these kind of interventions personalized specifically for young people living with and beyond cancer all over Europe. But of course, unfortunately, that's not yet the case. But hopefully everyone listening can keep all of these insights to hopefully make improvements over the years. Are there any questions for Saskia from the audience?
I think there's a comment in the chat. It's from Susanna, and she's saying that they made adaptations of the wheel in Hungarian, and yeah, they hope to introduce using it.
Yeah, that's great. Great, Susanna, to hear. And hopefully, lots of other clinics will follow this. And of course, they can get information.
That's also what Ian is asking about, that or if the PDF of the lifestyle wheel is available somewhere.
Yeah, it's in the presentation, and I will send the link. And I have written a
letter to the stakeholders asking for opportunity to adapt it in Hungarian, and they approved it, that we can do it, and they liked it. So we are happy and try to use it.
Is it easy to use, Susanna?
The problem is that the average Hungarian population is not really open to lifestyle changes at this young age period, and we should improve a lot in this sense. So including the lifestyle, the sports is which is lacking from many young persons' life. So we are not on the not so similar. I'm really impressed that you could convince so many people to work with the lifestyle coach, and we don't even have such a big number of lifestyle coaches who could lead the intervention in this sense. So I work as a GP, and I always try to be in contact with the families. I try to promote the healthy lifestyle, but it's not an easy thing. Just we have a very good for obese children. We have good programs, but it's also a difficult group of intervention. But it has to be very, very intensive, and we work together with as GPs with the specialist to go on with the lifestyle change and regular counseling to go on with physical activity as well. So I think it's a really difficult adventure and mostly it works if the whole family is compliant with changing the eating habits and also starting the movement. So it's difficult. It has to be a collaborative action, I think.
Yes. Thank you, Susanne. I think you also brought up some new points that are
It's
very
really
important.
Just we have to speak a lot about this to have a positive change in lifestyle. But it's one of the most important goals for the long-term follow-up, I think.
Yes. Are there any other questions from the audience for Saskia, or any other comments? Otherwise, we will of course try to get the lifestyle wheel that you can use as for yourself to look at, but also if you are healthcare providers in your consultations. Maybe Saskia, if you can get it in the chat. Otherwise, I'll share it after this webinar.
I'll put it in the chat. I will do that during the next presentation.
Thank you very much. So I will introduce the next speaker. It's Rui Rocha, and he's a young person with a lived cancer experience, but he's also a digital content creator, and he's a university student in sports science and an author. And yeah, we are very happy that you will share your experiences with us. So the floor is yours.
Hello, everyone. I'm Rui from Portugal, and what I'm going to say today is not scientific things. It's just my experience to make everyone feel more comfortable about their own experience. Because I know there's a lot of people that live through cancer. They are not that comfortable talking about cancer themselves because they see it as a bad trauma. But my experience with cancer is a really good one because I was treated like a baby. Like a literal baby because I was in a child's hospital at 15 years old. So they treated me very well, and I don't have that many symptoms as well. I didn't have any type of secondary effects of chemotherapy or radiotherapy. So I don't have I can't relate to the people who say, oh, I vomit a lot during treatments and everything. So that's my own experience. But
Sorry, Rui, to interrupt. I'm so sorry. I'm not sure if it's just me, but I cannot see your video. Okay, everyone else as well. Is it not working, or otherwise can you try to turn it off and on? If it doesn't work, it's also fine.
can see mine. I don't know.
Yes, now it's turned off. Oh, yes,
Ah.
there you are. Perfect. Thank you so much. Sorry to interrupt,
Okay.
but this is much
Fine.
nicer to see your face too.
So with my experience, after cancer, I was in a really bad spiral, like having suicidal thoughts, not valuing myself, feeling very bad. So I started to make a little journal about my emotions at that time. So when I was writing, I went to a book launch by my mom's friend who also had breast cancer, and she challenged me, Hui, why don't you launch a book as well? You have such a nice experience. Why don't you share it as well? So I treated my journal as a book. So I started writing everything that I felt, everything that I've been through until last February, and it's on its way to being published. So in a couple months, it'll be out in Portuguese in the beginning, but hopefully we'll get the English version. And with that I felt like I had like a little mission, like an objective in life, is to share my word and my experience with everyone else that's been through what I've been through, which could be bullying as a kid, with being overweight or having cancer or mental health advice or something like that. And with everything that I've like accomplished, not really accomplished, I felt lost because I had a lot of goals, but no like routes to follow that. So I went day and night going through studies and getting a little more about the authors and what they bring into the studies and everything. So I built, not really built, I made my own science study. I'm not going to release, but I made my own experiment. Is the better word. I made experiment, especially during physical activity, because I work out since I was 14. I stopped at 15 when I was diagnosed as well. But I've been actively in the gym for the last 4 years, 4 or 5 years, and I've been very lost because there's a lot of information about the gym, but not very specific. It's very broad, the information that we have. So I try to comply the studies that we have of cancer patients and physical activity, and try to not collide, but to connect them and make my own experiments to see what are the results of it. So I've been through it and I've been very enlightened because it's something that we don't have as much. We have very few studies about physical activity and cancer patients, but we have like 10, 11, and it's always about the general type of cancer, like stomach cancer, colon cancer, and everything like that. So I tried to make my own experiment with a different type of cancer, which I had, the germinal, and with that I tried to make myself stand out a little bit by being a different person, whether it's in the gym or at school or even at home. So that's my experience.
Thank you very much, Rui, for sharing your experience. Did you, can you see, we've heard a lot about this relationship of physical health, mental health, and how it's so intertwined, because you mentioned that you were also struggling mentally a lot. Did you notice that there is a relationship there, or how was that for you, if you want to share more?
I noticed the connection when I prepared myself mentally first before I prepared myself physically, because going through those studies that I've searched, if you don't put your mind into something, you really can't do it because you're not mentally focused to do something. I think everyone knows what I'm going to. If you don't put your mind into something, you'll never reach that goal because you're not focused enough to reach that goal specifically. So your mind is really your motor, or your motor to your car. Your body is just your car, but what makes it work is your brain. I don't know if that makes sense.
It makes perfect sense. Thank you for sharing. Are there any other questions? I wanted to ask about your book that you told us about. What is the book about exactly? And is it about your whole story, or is it a special part of it?
It's about everything that I've been through, but I try to make the positive points stand out instead of the negative points, because as everyone knows, where are we going? There's a lot of negative stuff going and not enough positive stuff going on. So I try to stand the positive points out to make people feel inspired by it, and not, okay, there's another sad story. It's not a sad story.
Great. So thank you. And just let us know when it's published.
Yeah, I'll tell everyone, don't worry.
Thank you. Are there any other questions for Rui? I don't think so. Then I am very excited to announce our very last speaker, and I think he will also go into what I've just asked about a bit more, about the relationship of the physical well-being and the mental well-being, or as Rui says, the mind and the car, which I also really like that metaphor. So our last speaker will be Mark Sampedo-Pillegaard. He's from Denmark. He's a senior researcher and associate professor, and he specifically researches how the Young Adult Taking Action program, the YATAC program, can support young adults in their everyday life after cancer. And I see you're already sharing, so the floor is yours. Very excited for your presentation.
Well, thank you. You can see my slides now, or? Yes.
Yes.
Okay. But thank you for inviting me for this webinar. And you, Tessa, did the introduction. So, but as Tessa said, I'm a senior researcher and an associate professor from a hospital department called Social Medicine and Rehabilitation. Is a hospital called Gystrup Hospital near Aarhus, if you know that city. But if you don't know, it is the second largest city in Denmark. And I'm also associate professor at Aarhus University. And today I will talk about the Young Adult Taking Action program, which address rehabilitation for young adults with and after cancer. And the project is a postdoctoral research project conducted by Maria Aasen, which you can see on the picture. Now I have to find, yeah. So the project is funded by the following organizations, including the Danish Cancer Society. And just to show you briefly the organization of the project, I'm the principal investigator, and Maria is the project leader. And we have an advisory board comprising national and international researchers within the field. We also have a project group with Danish researchers and young adults with experience of having had cancer. And finally, we have Danish organizations and the two municipalities which we are conducted research in. So in this project, we focus on young adults aged 18 up to 39 who have been diagnosed with cancer. They are currently receiving or have completed curative intended treatment for any type of cancer. We know that young adults are particularly vulnerable when they are confronted with serious illness, both due to their age, but also because of the other demands from the society and family and friends, because in these periods, they often are leaving home, are starting further education, are starting more serious romantic relationships, are entering the labor market, starting family and life, and buying house. So a lot of transitions. And when a serious illness like cancer hits, it can, of course, impact all these kind of issues. So from research, we know that young adults with cancer differ from younger and older adults with cancer. We know that they experience physical, psychological, social, and existential challenges that limits participation in everyday life and can reduce quality of life. We also know that rehabilitation is beneficial following cancer treatment. However, young adults require or want rehabilitation interventions more specifically target their needs. Currently, no rehabilitation interventions comprehensively address the multifactorial challenges and needs the young adults experience. So, but what is rehabilitation? The WHO defines rehabilitation as a set of interventions designed to optimize functioning and reduce disability in individuals with health conditions in interactions with their environment. Rehabilitation therefore target functioning and disability. And the International Classification of Functioning, Disability and Health, the ICF model, defines functioning and disability as outcomes of the interactions, the dynamic interaction between a person's health condition and contextual factors, including environmental and personal factors. And functioning encompasses body functions and structures, activities, and participation, and with support from the environment, for instance, from family and friends, from peers, from rehabilitation services, functioning can be improved. Personal factors within young adults can also improve functioning, for example, by using efficient coping strategies. So just to try to explain it in terms of specific problems, young adults have problems at body and structural level. We know that young adults experience neurodegenerative deficits, fatigue, psychological distress, cardiovascular diseases, infertility, and sexual dysfunction and physical functioning. At activity and participation level, they have problems with education and work many years after a cancer diagnosis. They have problems with life and family, with self-care and household activities, leisure activities, dating and relationships. And collectively, this can lead to disability and reduced quality of life. So this call for a multi-component intervention. So the overall aim of the Young Adult Taking Action Program is to develop and evaluate an evidence-based, co-produced and age-specific rehabilitation program improving self-efficacy and quality of life for young adults aged 18 to 39 who have had cancer. The project is developed using the British Medical Research Council framework for developing and evaluating complex interventions and can consist of 4 phases: a development phase, feasibility phase, evaluation phase, and an implementation phase. And in Maria Olsen's PhD, she was PhD student on the first phase. She developed the first version of the intervention program. And the central element in the development phase was to engage young adults and health professionals to co-produce the content of the intervention. And in her postdoctoral research project, she is currently testing the intervention in 2 Danish municipalities, in Copenhagen and in Aarhus, where we have completed the feasibility study in Copenhagen, and we are just about to begin the pilot RCT study in Aarhus in August. So phase 1, which was part of Maria Olsen's PhD project, these 5 papers were produced addressing needs among young adults and the current evidence for rehabilitation interventions. And based on this, young adults and health care professionals during 6 workshops co-produced the content, which also included preliminary testing of elements from the intervention in a research clinic in Denmark. So the program looked like this. The program is mainly group-based, peer-to-peer supported, and consists of psycho-education from healthcare professionals about different topics. Behavior change is therefore an important part of the program because the sessions the intervention aim to provide for the young adults provide different kind of coping strategies, which they need to and try to work to adopt and implement in their everyday life. So this is also something that is discussed during the sessions with the young adults and the professionals. And besides psychoeducation, physical exercise is also an important part of the intervention, which is provided weekly. The groups is a group-based intervention, and they typically include 5 to 15 young adults in each sessions. And the intervention is part of community-based rehabilitation services. So the young adults have to be physically present at these sessions. And the duration is 16 weeks maximum. The first component is a standardized assessment to identify and describe rehabilitation needs, as well as possible wishes, dreams, and hopes. And this session will inform which of the following 7 components the young adults will receive. So each session is tailored for the individual young adult. So each person may only require, all are receiving the needs assessment, but for instance, a young adult may only say, I only want physical activity combined with mental health session. and that is totally fine. So component 2 is about how to manage fatigue, sleep, and concentration in everyday life, which is provided by an occupational therapist. Component 3 is physical exercise, provided by a physiotherapist. And component 4 is about mental health, which is provided by a psychologist. And component 5 address sexuality and relationships, provided by a nurse. And component 6 is about family and friends, also provided by a nurse. And then component 7 is about diet, given by a dietitian. And lastly, a session about study and work, which is provided by a social worker. So this shows the 16-week program, which includes weekly physical exercise and various psychoeducation topics, including the ones I mentioned before. And the psychoeducation session have a duration of about 2 hours, and the physical activity session about 1 hour. So now I will show you some of the results or the quotes from phase 1 of the study, from the young adults who have participated in the qualitative feasibility study. A young adult said, after I have participated in the intervention, I have truly felt lonely, and I thought I was the only one feeling everything that I feel, but I have now realized that I'm not. Another young adult said, I think it's valuable to learn about fatigue, but it's just as important to hear that others face the same issues as I, and I want and what they are doing about it in their everyday life. That I learn a lot from. So the peer-to-peer support has been incredibly important for me. And another said, before I went, I hoped it would be lecture-style sessions where I could just sit back and zone out. I felt overwhelming to have to engage with so many other sick people, but that interaction was actually what I really made a difference. So that the fact the most of it was in the groups was essential for me. And lastly, if another young adult said, if I haven't attended the program, I wouldn't have progressed as far in my process, especially in terms of returning to work. I don't think I would have turned to full-time work by now if I hadn't been here, received all the tools I have, and had the opportunity to share my thoughts. So I just want to, ways that we have a LinkedIn profile that you can follow to stay updated on the latest progress of the project, if you would like that, and some references if you are interested to go a bit deeper in some of the details I have introduced today. Well, thank you.
So thank you so much for sharing all this and sharing all these details. Are there any questions in the moment?
In the meantime, maybe I can just read out what Joanna has shared in the chat, I think in reaction to your slides with all the components. She said, infertility caused by treatment is something that is rarely discussed, but it has a huge impact on our future. Fortunately, my doctors warned me about fertility preservation, and it helped me maintain my mental health. It has a huge impact on the lives of women over 30, but not only, of course, she shared. And I think that, again, through that personal experience, highlights so much how there's so much going on in our lives, and they all impact each other. Mark, I'm not sure if this is something that you heard more often, that there may be one thing which may seem very medical, but then it has an impact on your mental health, on your everyday functioning. Is that something that you saw, or how was your experience there?
Well, I don't know, but what I know is that the young adults we have talked with are saying that they are not typically asked about these things either, as the participant said. The main things which is provided here in Denmark is physical exercise. We have some places in the municipality where we provide a broader scope of interventions. But if they interact, of course, if you have something problem with your mental health, that of course may impact on your ability to engage with other young adults or with leisure activities. And that is why I also showed you the ICF model, just to show you that problems at the body level and structure level can impact other kind of issues in young adults' everyday life.
So thank you. I also wanted to add, there was one comment from, I think, a participant that the community thing and the talking to others was so important. And I think that's
Yes.
something we also, know, and which also is part of YARN, but also of survivor associations, that often this being together with others who also share this lived experiences is so important.
Yes, that is one of the main ingredient in the intervention, and something the young adults also have raised during the development phase, that the peer-to-peer support and sharing experience and be part of a group is very important also to help each other regarding different issues. Yeah.
Thank you. Are there any other questions for Mark, or looking at the time, also any other general remarks or questions? Please go ahead and raise your hand or put them in the chat. Okay, if that's not the case, then I will share my very final slide with you. Thank you very much for attending this webinar. I hope it was useful. If it was or wasn't useful for you, please use the QR code or go to the link in the chat and let us know how you like the webinar, if there's any other topics you would like us to cover, or if there's anything we can do to improve future webinars. As I said, this webinar is recorded and we will upload it to the YouTube channel of YARN as soon as I can do it. So as soon as I can do it, we will try in a couple of weeks, but you will see it once it's there. We will also share all of the slides from the presenters with you after this. And I would just really like to thank my co-moderator Eva for taking the time to moderate this webinar together with me. And of course, also to all the speakers, David, Ian, Rui, and also Saskia and Mark for sharing your insights. As I said, we hope it was useful for you. Please let us know through the forum what we can do to improve future webinars. And I'm not sure if you have any last comments, but I feel very motivated to go out now and enjoy the good weather in Germany, at least. It's very nice, and to spend some time with friends. I think we all want to do that now.
I think so too. I just wanted to thank you for the organization. It was a really great webinar. So yeah, and then I would say let's go out and have fun.